Why do neuromodulatory devices have positive anti-ictogenic effects for patients with epilepsy? Note how I phrase that question. Not do neuromodulatory devices have this effect, but why? The clinical evidence shows us that as a treatment for epilepsy, neuromodulatory devices are pretty effective. We also know that these devices, particularly via deep brain stimulation, are extremely effective for patients with movement disorders such as Parkinson's. But we know less about why these devices have these desired effects, what changes are happening at the neural circuit level, and what mechanisms are causing these changes. That led epileptologists to opine that, quote, neurostimulation for epilepsy often has moved retrograde from pilot clinical studies back to the laboratory for validation and modification of stimulation methods. So in order to move neuromodulation forward as a clinical treatment for epilepsy, we need to start better understanding why it works, how it achieves these effects, and how we can perhaps tune and optimize these effects to get the best outcomes for patients with epilepsy. Computational neuroscience is uniquely suited to answer these how and why questions about neuroscience. In using these tools, we've designed a study that we believe shows the mathematical underpinnings of why neuromodulation has the effects that it does on neural networks. And that's what I'll be discussing in my poster presentation, P204, at the 2020 CNS Virtual Meeting.